This is a diabetic foot, and in many countries without foot and ankle specialist or podiatrist, this foot is a candidate for amputation. One of the key considerations as clinician would be to um, consider tight metabolic control. So ensuring that the patient has optimal blood sugar control. The patient is not hypertensive. If they are, this is well controlled as well. Ensure that if the patient has high blood cholesterol level, this is well controlled as well. The next step in managing this sort of patients would be to do some basic bloods. So you want to do some full blood count, ensuring that the patient is not anemic because this can impact on wound healing. You also want to check for things like the white blood count, or the white blood cell count, the neutrophils, the lymphocytes as well, just to ensure that this is in check. The next bit you want to also do is you can check for things like acute phase reactants, as we call them, like C-reactive protein. You can also check for things like ESR, which just tells you about if there's a systemic inflammation going on. You also want to consider things like renal function test. So that's the kidney function test essentially. So it's been seen that people with poorly controlled diabetes can have problems with their kidney as well. And if the patient has problems with the kidney, it means the urea level can be quite high in the blood. And based on research, urea has an impact on the aggregation of white blood cell, which means that the fighting of infection in that site of the wound would be very, very slow. So this is one of the things that you want to also consider. You also want to make sure that the patient has, good liver function. So do some liver function tests in your blood checks as well, because any medication you're giving to this patient will be metabolized in the liver. The next step in managing this sort of patients will be to take some swabs. Okay, so if you can't take some deep tissue swabs, that would be good, or you can take some tissue sample as well. That would be quite good, and send it off to the lab to get some MCS, which is microscopic culture and sensitivity. You can start the patient on broad spectrum antibiotic if you suspect any infection, and based on the outcome of the swab or the outcome of the result, you can switch your antibiotics uh, as per your hospital protocol. The other next steps to consider in managing this patient, you ensure that you've done some Doppler check, which is what we use in clinic just to check the blood supply to the lower limb. You could do some ABPI, which is the ankle breaker pressure index, or you can just do some Doppler check to ensure that the patient's got adequate blood supply to the foot. Because if the blood flow to that area is poor, it's also going to affect the healing process. And based on the outcome of that, you might want to involve the vascular specialist to help in terms of restarting or ensuring that it's enough blood flow to that area of tissue damage. You can also consider doing an X-ray for patients like this, and sometimes in patients with prolonged poorly managed diabetes, you can tend to see calcification of the so if it's calcified, there's poor blood flow to that area, which can impact on the healing of the wound or the ulcer. So that's one of the things that you also want to consider. The next step is you want to ensure that the wound is well managed. So prepare the wound bed. So if you have to debride devitalized tissue based on your protocol as well, and then use the appropriate dressings or the wound dressings for this patient. Um, Next steps to consider would be to offload the area. So this area has to be properly offloaded because you could put the best dressings on it if the patient's walking on the area of the ulcer because of that mechanical pressure on that site is going to impact on the healing process. So this is some of the things to consider when managing patients like this. And if you have any concerns about foot and ankle issue, ensure that you see your podiatrist or you see your foot and ankle specialist.